Overcoming the barriers to dissemination and implementation of quality measures for gastrointestinal endoscopy, European Society of Gastrointestinal Endoscopy, ESGE, and United European Gastroenterology, UEG, position statement. Introduction. 5 years ago, the European Society of Gastrointestinal Endoscopy, ESGE, and United European Gastroenterology, UEG, initiated the ESGE Quality Improvement Committee, QIC. The aims of this project were 1. To improve the global quality of gastrointestinal (GI) endoscopy in Europe and to deliver a patient-centered service in the field of endoscopy. 2. To promote a unifying theme of quality in endoscopy within different activities of the societies. 3. To create a clear quality improvement framework. And 4. To assist all endoscopy units and endoscopists in achieving these standards. From 2015 to 2019, ESGE developed performance measures that allow the assessment of the overall quality of endoscopy in Europe within the various aspects of endoscopy, including the endoscopy service itself. During every UEG week, UEGW, and ESGE meeting over the last 4 years, the theme of quality was further addressed, and the work of the different working groups was explained to the members and attendees. Finally, the framework for quality assessment and improvement was established and the bar was set. Now it is time for dissemination and implementation of these quality indicators. There are several barriers preventing the immediate adoption of performance measures in daily routine endoscopy, including lack of motivation, resources, and/or leadership. Such barriers may be successfully overcome by a directed and thoughtful dissemination of the performance measures, as well as by the use of educational or technological interventions. The aim of this position statement by ESGE and UEG is to address those barriers that may prevent acceptance and implementation of performance measures in our endoscopy centers, and to suggest possible interventions to overcome such barriers. Methods. This position statement is based on expert opinion owing to the lack of evidence-based data on the topic of dissemination of performance measures. To address the interest in quality in endoscopy and the possible barriers to implementation, ESGE conducted 2 surveys among its 49 member societies in 2017 and again in 2019. Responses were received from 32 member societies, 27 European and 5 non-European. This position statement addresses both possible barriers to the adoption of performance measures and interventions to overcome these barriers. Recommendations. Endoscopy societies should take a leading role by endorsing, adapting, translating, if deemed necessary, and assisting local health authorities in the implementation of ESGE performance measures. Barriers against performance measure implementation should be locally identified and classified into specific categories. Endoscopy societies should prioritize a set of performance measures, taking into consideration local factors such as disease prevalence, performance measure relevance, and the feasibility of performance measure implementation. Educational and scientific interventions should be implemented or endorsed by endoscopy societies to disseminate performance measures. The use of new or existing electronic databases to audit performance measures, such as the ESGE Quality Check app, is also desirable to facilitate performance measure assessment.